Hello everyone, myself Dr. Tapas Kumar Pal and welcome to our channel Physiomax Organization. We are continuing our anatomical education series under which today we will be reading one of the most important that's points to remind to start osteology. As we have discussed, now we will start about the osteology series. So before that we need to remind few of the important points which is quite necessary to read the osteology. So under the part of Physioversity, this is another series we are about to start. So let's see, when we read any sort of osteology, what are the points we need to remind before of that. So we can see over here there are total 7 points. The number 1 is the anatomical position, number 2 is the site determination, number 3 is the ossification, number 4 is the bony landmarks, number 5 is the muscle attachment, number 6 is the ligaments attachment, and number 7 it is the clinical anatomy. So whenever we will be reading any sort of osteology, we need to remind these 7 points. Now one by one we will be reading and we will be knowing each of the terminologies and what is the meaning of each. So with the first point, that's the anatomical position. The anatomical position, that means what is the position of the bone. Each of the long bones, it's having some of the parts like head, neck, shaft and the tail. Which is the head, which is the tail, or which is the anterior aspect and which is the posterior aspect of each of the bones, and that's what it's called as anatomical position. The second point, it is the side determination. That means in which side bone we will be holding, or whatever bone we are holding, it is of which side. Either it can be a right or it can be a left. Seeing the bone or seeing few of the bony prominence with its projections, we can clearly see that which side bone it is, and that's what it is called as a side determination. The third point, it is the ossification. Ossification, it means how the bone is getting matured. Each of the bones is having few of the ossifications like the primary and the secondary ossification. It's like when the baby in the mother's womb during the uterus, that's what is the primary ossification starts, and the primary ossification ends for most of the bones within an age group of 2 to 3, and then when the secondary ossification starts, and for most of the bones it's end from the age of 18 to the age of 20, and that's what it is called as a ossification. And because of these ossifications only, there is a maturity of the bone. The next point, it is the bony landmarks. Each of the bones, it's having few of the bony parts like this or like this. These are having its own different names. So these what it's called as a bony landmarks. With example like greater tubercle, with example like lesser tubercle, with the example of the head of the humerus, with the example of epicondyle, these can be example of bony landmarks. The next point is the muscle attachment. Muscle attachment, it means how the muscle comes to the bone or how the muscle goes from the bone. Few of the muscle with its tendons insert to a bone, that's it's called as a insertion, and few of the muscle which goes from the bone, that's it's called as a origin. That means each of the bones is having a insertion of few muscle, and each of the bones is having its origin of few muscle, and that's what it is named as a muscle attachment. Ligament, the most important structure for the stability, which is attached to a bone and which is present near the joint to give the joint stability. We need to remember few of the name of the ligaments which are present with each bones to make a stable joint. And the last point is the clinical anatomy. So clinical anatomy is the another part where we can learn the clinical condition of the each bones. So with these 7 headings, we can clearly understand that what we need to remember when we will be reading the osteology. So once more to repeat, under these 7 points only we will be reading the osteology. So with this we will end up of today's session, and the next session one by one of each of the bones of the human body we will be reading now. So that's what about today's class. Hope you have enjoyed today's class, and we'll continue our educational series. So stay tuned with us. Thank you, and don't forget to subscribe this channel, and don't forget to like the video. Thanks everyone.